Nurse Bob D is on it again. Another live stream section with Nurse Bob D. Please, if today is your first time seeing my video, make use of the subscription button and tap on the notification bell to stay informed and to be the first to be notified whenever I post new videos. So where are you watching from? Please make use of the comment section. I'm streaming live from Nigeria, Port Harcourt, Rivers State. And to my returning subscribers, I'm grateful. I appreciate all your efforts, your engagement. Thanks for the courage. I appreciate. So our topic tonight says, let's talk about periodic health check. Let's talk about periodic health check. When last did you visit the hospital for a regular or periodic medical check? That is a question. So please, I'll be on the comment section to hear your view. When last did you visit the hospital? Did you visit the health facility? When last did you book appointment with your physician or your personal consultant, your doctor, on one-on-one consultation? That is what we're going to be talking about today. When last did you visit? You are supposed to be visiting the health facility for a periodic medical check at least once in 6 months, twice in 6 months, depending on your health status. If you're not ill, at least you're supposed to be visit the health facility once every 6 months for a periodic health check. So when did you visit the health facility last? When did you have a section with your personal doctor, with your consultant, with your physician, with your health personnel? When last did you visit the health facility? It's essential we visit the health facility from time to time for a periodic or regular medical check. Reason being that most times you might think you are okay, but a lot of factors might contribute to you being ill, and except you visit the health facility, you might not know. But most times we tend to wait until our health condition deteriorates, until complications set in before we can visit the health facility. Please let me know who is online, who is watching with me, and don't fail to tap the screen, double tap the screen. Please let me know I have someone, and let me know where you're watching from. Wow, I'm seeing 6 persons online with me. Please identify yourself, let's connect. Let me know where you're watching from, and also don't fail to double tap the screen. All right, Opemi Oladipo. Do I prefer live on TikTok or YouTube? Actually, I'm not on TikTok, okay? I do basically. Raja, thank you. Nice having you on board. Oladipo. Actually, Osmoville. Hi, good evening. Thank you for joining this live session. I'm grateful having you all on board. Please let me know where you're watching from. I'm streaming live from Nigeria, Rivers State, Port Harcourt, precisely. So please let me know, and don't fail to tap the screen, double tap the screen. Let me know I have people on ground. Double tap, just tap. Let's continue this section. Okay, Oladipo, like I was saying, I'm actually not active on TikTok. I don't even have a TikTok account, okay? So I do my things on YouTube and Facebook. So I don't really do, I wouldn't know how the importance of live section on TikTok or YouTube, except I have an account, I open an account there with TikTok, but for now I actually don't have an account there. Osmoville, I'm streaming live from Nigeria, Port Harcourt, Rivers State. Please tap the screen, double tap the screen, please. Double tap the screen. Let's continue. Okay, thank you for joining me tonight. I'm grateful having you all on board. So like I was saying, When last did you visit the health facility? It's essential we visit the health facility from time to time. It's a necessity. You don't have to wait for complication to set in. You don't have to wait to be critically ill before going to the hospital, before booking a section with your consultant. And if you're Henry Lou, thank you for watching. Thank you. Watching from Port Harcourt. Wow, nice having you on board, sir. Thank you, sir. Thank you for joining. Please double tap the screen, double tap, double tap. Let's continue. So it's essential you visit the health facility from time to time. It's a necessity. You don't have to wait to be critically ill. You don't have to wait for complication to say medical check. When did you visit the facility for a regular health check? You felt all is well with you. Hi, sir. Thank you, sir. You felt all is well. Most times you wouldn't know until you visit the health facility. So it's essential from time to time you visit. Investigations will be carried out. You'll be examined, and physical examinations and other necessary investigation will be done to ascertain your health and your overall well-being. But if you don't visit the health facility, if you just depend on you're okay, you might get it wrong, because the environment where we are, we're exposed to a whole lot of free radicals, from pollution, from water, environment, from food consumptions, the things we eat and all that. So you cannot really say that you're 100% well or you're perfectly okay until you visit the health facility for a health check. Please, I'm still waiting. Osmo View, Raja, Oladipo, please double tap the screen, double tap the screen, double tap. Let's continue. At least let's have 5 tap on the screen, 5 persons tapping on the screen. Okay, you can tap as many times as you want. Okay, so you don't have to wait for you to be critically ill. Like I said earlier, the environment where we are exposes us to a whole lot of things. So you might think or assume that you're perfectly okay until you visit the health facility. Then you realize that there are some underlying illness that you might not know. Sometimes we tend to ignore some symptoms or some signs that our body, the signals our body gives to us. We might tend to do self-medication, over-the-counter medication, buy painkiller, or self-medication, we take anti-malaria and all that, and it will subside. But most times it is far more than that you need more treatment than just those medication. Those a lot of different illness present with similar signs and symptoms, which you might confuse the one for other health issues, to malaria or to typhoid. But except you visit the health facility, you might not know. Don't fail to tap the screen. And if today, please, is your first time seeing us about this channel, please subscribe and also tap the notification bell. Stay informed and updated whenever I post new video. Okay, so you might not know until you visit the health facility. That is why regular health check is essential. You have to visit the health facility from time to time to ascertain your health and your wellness. Most times let me say in my own area here in Nigeria, because it might not be like that in other places, but within our environment here, most persons tend not to go to hospital. They will wait until complications set in. Before they will not get to the hospital, and you'll be expecting the doctors or the nurses or the health personnel to perform miracles, to perform magic. Most times, even after the delay, complications set in. The same money you've been avoiding to spend, you will spend it and even more. Most times the health deteriorates because you allow yourself to be this ill, critically ill, before ever visiting the health facility. So is there no wisdom in it? If visiting the health facility, then see doctor and prescriptions will be given to you to take medications, and then you will be better, instead of waiting for when you'll be critically ill, or when complications will set in visiting the hospital and still spend the same money or more than what you are supposed to spend when it was earlier on. Which will you prefer? Which will you prefer? Think for me, there's wisdom in visiting the health facility periodically to ascertain your health. If you go to the health facility, definitely there's nothing wrong with you. They will definitely tell you nothing is wrong with you. Everything is perfectly okay. You will still go back to your house without spending a dime apart from the investigations. But whereby you visit the health facility and some things that you don't know is unveiled to you, you have to treat it and you'll be okay. Why waiting for complication to set in? Why waiting for you to be critically ill before making use of the health facility? There's no wisdom in that. Do I still have anyone online? I'm still waiting for your tapping. I just seen one tapping. Double tap the screen. Let's continue. Okay, so there's no wisdom in it. So it's essential you visit the health facility from time to time. Other health personnel will attend to you and you'll be okay. But most times in this area, most persons prefer to go to church. Yes, someone will be ill and the person will choose to go to church, and you will be there. Some persons will be there 1 month, 2 weeks, 1 month, 3 weeks, 3 months, 6 months, more than a year, and you're ill, you're sick there. They will be asking to do to be doing prayer, fasting, assignments, and gradually your immune system is compromising. Your health is deteriorating, yet you still be in the hospital, in the church for prayer until when it gets worse. That is when you will know the road to the hospital. Why endangering yourself? Prayer is good, but the prayers can be done for you in your absence. There's no distance in the realm of the spirit. Your papa or your mama in church, your pastor's wife, or the ministry mommy can be praying for you wherever you are. And why the doctors and the nurses are carrying out medical treatment for you, then it will be better. But to the extent of going to the church, leave the church for a longer period of time when you're not ill, when you're ill, and then you say you are there, they are praying for you when you know that your condition is critical, and then when it gets worse, complications setting, then the church will not send you go to the hospital, and then when you go, there's 50% chances of survival. 50% chances of survival because you didn't do it when it was on the onset. You waited for your immune system compromised. Thank you for joining me. Please let me know who is online with me. Signify, please. And don't fail to tap the screen. Osbobdi streaming live from Port Harcourt, Rivers State, Nigeria. Thank you for having you all on board. We are talking about essence, why you should visit the health facility for periodic medical check. You don't have to wait for complication to set in. Make use of the health facility. The doctors and the nurses, other paramedics, other health personnel are there for you. That is why you have the health facility. So you don't have to joke with it. You don't have to wait for complication before you go to the hospital. Most persons is when complications set in, they have become critically ill in the hospital, and then you'll be expecting doctors, nurses to perform magic for you to get your foot back. It doesn't work like that. It doesn't work like that. That is why it is important you go to the hospital periodically for medical check. And if there's any sign and symptoms of illness identified, you'll be treated accordingly and you'll be okay. And not when you are critically ill. You will not come to the hospital. You have waited, complications are setting before coming to the hospital. So I'm encouraging us, please, from time to time, endeavor to visit the health facility. Endeavor to visit the health facility. Have a section with your consultant. You can book at the end of this live stream. I'm expecting you to put up a call across to your personal doctor, your health personnel, your health practitioner, your consultant, or visit the nearest health facility for a regular or periodic medical check. And it you'll be made no it you'll be amazed. You'll be amazed at some of the things that will be revealed to you. And if there's any conditions or any illness that have been identified, you will take precautions. You will know what to do to stay healthy, because health is wealth. So if you're not healthy, you're not wealthy. If you are wealthy and you'll be spending your whole money on treatment, then you are not wealthy. So health is synonymous to wealth. Until you are healthy, you are not wealthy. So prioritize your health over every other thing. Visit the hospital from time to time. Don't go to church and sleep in the church, or wait in the church for months or a longer period when you know that you're critically ill, and you will turn the church to hospital. Things are not done that way. So I'm encouraging us from today, please, the health facilities is there for the purpose of treatment and for checkup. So from time to time, make use of the health facility. One-on-one consultation. If you have not done that before now, as you are ending or after watching this live session, whenever you came online, whenever you come across this video, after watching this video, endeavor to turn a leaf. Make a decision from today to book an appointment with your doctor, with your personal consultant. Visit the health facility for regular medical check. Don't do self-medication. Don't patronize over-the-counter medication. It's essential you take your medication based on prescription. Don't wait for you to be critically ill before going to the hospital. You will not like the outcome. So it is better you do it when you know it is needed. Okay? So please, health is wealth. Live healthy and you'll be wealthy. Prioritize your health over every other thing. Don't walk and forget yourself. You will think everything is okay. No, there are other things that you might not know that you will need to, except you visit a health facility, you might not know that things like that exist. So that is why you have to prioritize your health over every other thing. Prioritize your health and your well-being. If there's anyone around you that is not feeling fine and the person is want to get to the hospital, or the person is going to church, please, especially in my country, Nigeria, discourage the person, ask the person to go to the hospital, let the person be admitted. Why prayers will be going on in the church for the person? Because church is meant for prayers and not for, it is not hospital. So let's change our mindset towards what we take to the church and what we take to the hospital. Prioritize your health over every other thing. Don't ignore any sign or symptom that you might notice. After today, any sign or symptom you have, endeavor to notify your personal doctor, practitioner. They will advise you adequately on what to do, instead of dying in silence, or instead of indulging in self-medication and over-the-counter medication. Endeavor to do the right thing at the right time. Okay, so please, health is wealth. Prioritize your health over money. Prioritize your health over pleasure. Prioritize your health over your job. Find time in the midst of your tight schedule. Endeavor to find time to go to the hospital and for periodic regular check, for periodic or regular medical check. Don't die in silence. Don't wait to be told. If anyone is sick around you, encourage the person to make use of the health facility and not indulging in self-medication. So thank you guys for joining me. I'm Nurse Bob D, streaming live from Port Harcourt, Rivers State, Nigeria. Thank you for everyone that joined me on this session. I'm glad to have you all on board. Please endeavor to subscribe to my channel. If today is your first time seeing my channel, please endeavor to subscribe for health information, and also tap the notification bell to stay informed and also be the first to be notified whenever I upload new videos. I promise to be giving you health information, health updates. You will never slack. So anything health, please visit this channel. You have them in numbers as you want. Okay, I'm here for you guys. And for my returning subscribers, thank you so much. I love you guys. Thanks for the encouragement. Let's keep on doing. So do have a blessed night rest. Okay, you wake up strong and healthy. Sweet dreams. Okay, depending on your timing or whenever you go to bed, be rest assured you have a good night rest. Thank you for joining. Anyone that's joining, please let me know where you're watching from, and also don't fail to double tap the screen. Double tap. There's only one tap I saw here. Is what are you waiting for? Why are you not tapping the screen? At least we will have gotten 5 tapping on the screen. Thank you once again. Till I come your way again, I am Nurse Bob D. Do have a wonderful night rest. Bye. Okay.